Have you ever noticed how a stiff joint can limit your movement, making everyday tasks surprisingly difficult? For anyone managing a muscle condition, recognizing subtle changes in movement or posture is a powerful tool. It allows you to address potential issues proactively and maintain better mobility. Spotting early joint contracture signs involves a careful observation of range of motion and subtle physical changes. Contractures are a shortening of muscles, tendons, or other tissues around a joint, which can restrict its natural movement. The earliest signs often appear as a slight difficulty in fully extending or flexing a limb, or a noticeable change in posture, such as a shoulder pulling forward or a heel lifting off the ground. The core mechanism behind contractures in conditions like muscular dystrophy is often a combination of muscle weakness, imbalance, and decreased movement. When muscles are not regularly stretched through their full range, they can gradually shorten and become tighter. This is compounded by muscle degeneration, where healthy muscle tissue is replaced by less elastic connective tissue. Over time, this tightening limits joint movement, making simple actions progressively harder. To effectively monitor for these changes, regular and consistent observation is key. First, pay attention to daily activities. Does reaching for an item, getting dressed, or walking seem to requiring more effort or a different motion than before? Second, gently assess the joint's range of motion. For example, can the arm still fully straighten at the elbow? Can the wrist bend back completely? You might notice one side feels tighter than the other. Third, look for postural shifts. Are shoulders rounding forward, or is one hip always slightly higher? Fourth, listen for any complaints of discomfort or a pulling sensation during movement, especially towards the end of a joint's range. A useful practice is to establish a simple baseline of typical movement and posture. This creates a personal benchmark. The term passive range of motion refers to how far a joint can be moved by someone else without the person's muscle engagement, and monitoring this can reveal contracture before active movement is significantly impacted. Regular measurement with a goniometer, a medical tool for measuring angles, can also provide objective data over time, helping to track very small changes that might otherwise go unnoticed. Understanding these early indicators empowers you to work with healthcare professionals, such as physical therapists, to implement strategies that can slow progression and preserve functionality. By catching contracture signs early, you can explore targeted stretches, exercises, or positioning techniques that support joint health and enhance overall quality of life, maintaining as much independence and comfort as possible.